I'm Melissa Ponzio, and this is WebMD's Ask the Pharmacist. With McCary Weck-Marciniak, National Spokesperson for the American Pharmacist Association, Clinical Associate Professor at the UNC Eshelman School of Pharmacy, and practicing pharmacist. She's here to answer the most frequently asked pharmaceutical questions put to us by you, the WebMD community. Our topic today deals with issues facing a new mom. Things like medication and breastfeeding, treating an infant who's not feeling well, and even diaper rash. So let's get started with our first question from a new mom who asks, what kind of over-the-counter pain relievers can I take while I'm breastfeeding?
There are a number of over-the-counter pain relievers that a woman can take while she's breastfeeding. One might be acetaminophen, which goes by the brand name of Tylenol. Another is ibuprofen, which has a brand name of either Motrin or Advil, and also naproxen, which has a brand name of Aleve. Those would all be appropriate to take for someone who has pain while breastfeeding.
Okay. Is taking Divalproex ER okay for breastfed babies?
Now, Divalproex is a medication that's more commonly used to treat seizures. And the question that comes into when treating seizures is sort of benefit and risk. The benefit to the mother versus any potential risk to someone while breastfeeding. Now, it's possible that some of this medication may be transferred into the breast milk. But the American Academy of Pediatrics says that it can be compatible with breastfeeding. So I think it would be okay for a woman to use this while breastfeeding. But of course, we'd want to check with her primary care provider who's managing her use of this medication. Because perhaps, depending on what she's using it for, if it is seizures, there may be other choices that might be better. But yet, if this is a medication she's been maintained on for quite some time, then we'd like to keep that, and we'll just keep monitoring.
My doctor prescribed promethazine, and I am breastfeeding my child. Is it still safe to take this?
So I think I would make sure that this person talk with their primary care provider to see, first of all, if there's something else that could be used to treat her symptoms, if it is nausea that they're trying to treat. There may be something that's a little bit more compatible with breastfeeding. But in the absence of that evidence, it probably is safe to go ahead and try to use this medication. But I think in this case, I'd like the woman to talk with her primary care provider.
My 2-month-old daughter has a stuffy nose and cough. What over-the-counter can I give her?
So when treating young children for cough and cold, we try to stick with some non-drug measures. So for someone so young as this child, I would like to not use some of the non-prescription products and instead maybe choose some non-drug measures. And a good one for congestion would be nasal saline. So nasal saline drops would help to relieve some of that congestion for that child. Another great choice is a humidifier, particularly a cool mist humidifier. And it might be great to start one of those in the room to add a little moisture in the room, and that might help to relieve some of the congestion. I think those are two safe options to use for a child this young. And if the congestion is very problematic, we might be able to use a nasal bulb syringe to remove some of that congestion. Those would be the measures that I would stick with when treating cough and cold symptoms in someone so young.
At what point are you able to give a child over the counter for a cough and cold?
So most of our cough and cold products are now approved for use in 4 years of age and older.
How much cough medicine can I give my 4-month-old?
Well, this question causes a little concern for me. I think that we would like to not use a cough and cold product for a young child. We're trying to stay away from that more often. So to treat cough in a 4-month-old, I would choose some non-drug measures. The first thing I think of is nasal saline. It's a great choice to help relieve congestion in a young child. And with that, you may be able to use a bulb syringe. And that way you can help to remove some of the congestion from the nasal passages. And a cool mist humidifier would be another great option to keep in the room to increase moisture and help to relieve some of that congestion. Those would be the choices I would have for a child this age.
You know, these last couple of questions have come from new moms that are trying to treat cold and cough symptoms in young children, and in both cases you haven't recommended a cough and cold product. Why is that?
Well, now we're getting more concerned about using cough and cold products in children. In fact, the FDA recently relabeled some of these products so that we do not use them in children underneath the age of 4. You know, and I'm a relatively new mom myself, and I can remember the times being tired and stressed, a little sleep deprived. And when your child's sick, you kind of want to think about using over-the-counter medicines like you have done to treat your own cough and cold symptoms. But unfortunately, what we found is that there's been risk of women unintentionally overdosing their children when giving them these cough and cold products. And actually, there's not even a lot of data to prove that they're effective for young children. So because they're really not effective, and there's the risk to even have an overdose and cause some very serious complications in a young child, we're tending to avoid using these medications altogether. And so I think better would be to use some of these non-drug measures we've talked about and to avoid use of cough and cold products over the counter for these young children.
I have a 5-week-old baby who has nasal congestion and cough. Would it be okay to give him a couple of drops of amoxicillin?
This question strikes some red flags for me. I think the first is it sounds like there may be some amoxicillin on hand that's been left over in the household. And so in general, when you're on a course of antibiotics, we want to make sure we keep that entire course of therapy and use all of our remaining medications. So that there's some left over in the household is concerning. And particularly for a 5-week-old, we wouldn't just want to give them a couple of drops of amoxicillin to treat a cough. In this case, for a child so young, we definitely want to talk to the pediatrician. And it's very rare, or I don't see very frequently, amoxicillin being used in children this young. So I think we'd like to go check with the doctor first. And again, for treating cough and cold symptoms for someone this young, I would stick with some of those non-drug measures, like the nasal saline or a cool mist humidifier. Those would be better choices.
Can I give Benadryl for an amoxicillin rash to my 5.5-month-old who weighs 16 pounds?
If this child is on amoxicillin therapy and has had a rash, that's something we definitely need to let her pediatrician or primary care provider know about, because a rash can come up with an antibiotic. In some cases, it's common and self-limiting and maybe uncomfortable, but it won't be a problem. In some cases, it could be very severe or life-threatening and could show that there's a really significant allergic reaction. So if you develop a rash while on antibiotic therapy, that's something you need to let the pediatrician know about and probably have that child come in so that a trained healthcare professional can kind of look at that rash and see if they can figure out what the cause is. It's something that's very difficult for a layperson to sort of look at and try to diagnose. So I would not just give Benadryl for a child to treat a rash. And for Benadryl in general, when given to young children, sometimes it excites them, and particularly in the case of a potentially drug-induced rash, a healthcare provider really needs to examine that further.
Is there an over-the-counter laxative for infants?
Constipation does come up quite frequently with children, especially as they're changing between things that they're eating and drinking. So it definitely is a common concern. But I think for laxatives, the best choice are some non-drug measures again. So definitely making sure the child is very hydrated. So as much water as possible would be great. Also, prune juice works very well. Prune juice can help to kind of alleviate some of that constipation. And if the child is drinking with a bottle or a cup, it can be just added into their bottle or cup or combined with some water. Those are really the best choices. We typically don't treat constipation in children underneath the age of 6 unless we've talked to a pediatrician first. So it would be best to talk with the pediatrician if some of those measures like the water or the juice don't work. In that case, if they've talked to a pediatrician, most likely what they'll do is use a glycerin suppository. That's a very safe measure that we can get over the counter as well. But I would want to make sure that we check with the pediatrician first if the constipation was truly problematic and not resolved from use of the water or the juice.
What can I use for diaper rash?
You probably cannot get through having a young child without having at least one episode, if not more, of diaper rash. So the best thing to do is to prevent diaper rash from the start. So if you notice that the child's bottom is getting a little bit red or irritated, then definitely using a diaper rash cream is helpful. I think one of the most effective products over the counter is ones that contain zinc oxide. It's a very nice skin protectant, and it'll keep that area dry and free from moisture, which is something that can help to start the rash. So definitely a zinc oxide product is what I would recommend, and definitely applying it as soon as you see any redness, and even when you don't, to help protect the skin, kind of form a nice barrier there so it doesn't start.